Hi, I'm Dr. Andrew Koivuniemi. I'm a neurosurgeon with Franciscan Physician Network, and I'm here today to talk with you about lumbar fusion. Lumbar fusions are one of the most common surgeries that we do nowadays as neurosurgeon. There's a lot of different reasons to have it, but it comes down to typically one purpose. The purpose being we need to stabilize your spine. Now, sometimes patients come to us where their spine is already unstable, where the bones are moving past each other in a way that they're not supposed to. This is called a dynamic listhesis. And in order to make certain that that doesn't get worse and cause pain in your back or shooting down into your legs, like sciatica, we can do a fusion. Other times we do fusions because the bones in the back need to be removed in order to take pressure off of the nerves. Sometimes we have to remove so much of the bone that if we were to just leave the surgery as it was, once you started standing and walking, your back has the risk of getting worse. So in order to prevent that, we put rods and screws into the spine in order to stabilize things. This is called a fusion. So the three most common reasons for spinal fusions are: number one is radiculopathy, or as some people like to call it, sciatica, where that's an electric burning pain that shoots out of your back and down into your legs. That's typically caused by a nerve or nerves in your back getting pinched. Another very common reason to have a spinal fusion is something called neurogenic claudication. This is a little bit different from sciatica in that it usually affects both of the legs. Patients often will tell us, "Hey doc, when I'm standing and walking, I'm doing all right, but after I've been up for a little while, my legs are getting really tired." They notice that there's pain that's shooting down in them. Sometimes I feel like I get better when I bend forward, and that makes the pain go away. That's what we call neurogenic claudication. What's happening is when you're standing, the nerves inside your back are getting compressed by the weight of your body. In order to relieve that pressure on the nerve, we have to remove parts of the spine. And when we remove those parts of the spine, sometimes we have to take so much that we need to stabilize it using rods and screws. The third reason that we typically do spinal fusions is to treat back pain. Patients who ultimately undergo spinal fusions have typically been on a long road. And the reason for this is spinal fusions are great for certain patients, but they're certainly not something that we would want to do for every single patient. Lots of times, our goal is to try to get you better without having to resort to this surgery. So we typically expect that patients who've had pain try to at first do what we call conservative measures. That would mean working with a physical therapist, trying over-the-counter medicines, and sometimes seeing a pain provider in order to try a targeted intervention like an epidural steroid injection. If, however, you've undergone these procedures and you're still having issues with your back, it might be time to talk about a spinal fusion. Most lumbar spinal fusions are not outpatient procedures. Usually you'll be in the hospital for 1 to 4 days, just depending on how much time it takes you to recover. That said, nowadays we've developed more advanced techniques such as minimally invasive lumbar fusions, and some of these procedures are able to be done as an outpatient. However, not every patient is a candidate for a minimally invasive option, and that's something that you're going to have to talk about with your surgeon to decide if that's right for you. Lumbar fusions come in all different shapes and complexities. Some larger surgeries can take up to 6 months to fully heal from. However, the majority are much quicker, so I expect most of my patients to be out of the hospital within 2 to 3 days, and I expect them to be back to work within 6 weeks. As a neurosurgeon, my goal is to help you get the best quality of life possible. I want to get you back to doing the things that you love as quickly as possible. That means trying to do the surgery in the most minimally invasive way possible that allows you to recover as fast as you can. If you continue to have electric or burning pain that shoots from your back down into your legs, and you've tried other things like medication, physical therapy, and injections, I hope that you have the opportunity to reach out to our group or a group like ours so that you can be evaluated by a spine surgeon. The good news is for these types of problems, we have a lot of very good options nowadays. And again, most of the time our patients do extremely well, are grateful that they've had these surgeries done. For more information, visit franciscanhealth.org.